To some health matters now. The World Health Organization has officially recognized Noma as more than a disease, but a social marker of extreme poverty and malnutrition, affecting the most vulnerable populations. WHO Director General Dr. Tedros Ghebreyesus, who said this, explained that Noma affects malnourished children and is mainly observed in areas like sub-Saharan Africa, with some cases in the Americas and Asia. Multiple risk factors associated with the disease include poor oral hygiene, malnutrition, weakened immune system, infections, and extreme poverty. It was explained that Noma is not contagious but tends to strike when the body's defenses are down. Treatment involves antibiotics, advice and support on practices to improve oral hygiene with a disinfectant mouthwash and also nutritional supplements. Of course, joining me live right now on the news to discuss more on this is Dr. Adetula Ife-Oluwa Abiodun, Team Lead, Zero Noma Initiative, Kano, Nigeria. Thank you so much for your time.
Thank you very much.
All right. Of course, let's get to it. Can you describe the prevalence and impact of Noma within the Nigerian context and its association with extreme poverty and malnutrition?
All right, thank you very much. Good evening, viewers. Concerning the prevalence of Noma, I think if I would take us a little bit back, at the Noma conference in 2018, the then Minister of Health said Nigeria do not have an official figure. And after this pronouncement, some work had followed afterwards, so that, for example, in places like Sokoto, Kebbi, Zamfara, some studies had been done, and some of those figures gave us something about between 7 and 16,000. Some other work were done in the north central part of Nigeria, in which that one also gave us a variable number. But the fact had been that there had been pockets of studies regarding the prevalence of Noma in Nigeria, but for now we do not have a national figure. However, there are different researchers, organizations working in different places, and hopefully with time, these figures will be brought together.
All right, now
concerning the impact. Okay, concerning the impact, I think when a patient has Noma, it affects, of course, it usually occur at the age of 2 to 6 commonly. And you agree with me that that's a period before some developmental milestones are achieved, education, socialization. So you have this defect on the face that affects human interaction. As such, it literally cuts off the person out of life. You can't go to school, you can't mix with people, you can't engage in economic activity. So it's really of great impact on the individual, and most times they are in secluded places that require that deliberate efforts to go after them, to fish them out and assist.
All right. Now let's talk about the primary risk factors contributing to the prevalence of Noma in Nigeria, and how do socioeconomic factors also intersect with health outcomes concerning this particular disease in Nigerian communities?
Okay, thank you very much. Noma, like we know it, it's an oral head disease that starts from you have gum inflammation. And of course, it occurs in a child that is poor and malnourished. For example, when you see a normal patient, you see the indices of malnutrition written all over. I shared some slides earlier where you see prominent shoulder blade, you see fluffy hair, protruded tummy. So it is closely related with malnutrition. And also, it has also been said that it's a disease of poverty. It is the poverty that predisposes this patient to live in an environment that is dirty, It's the poverty that makes that prevents such a person from accessing healthcare early, even at the point of the acute phase where you have this serious infection. The patient comes and they say they have nothing. So poverty, malnutrition, unhygienic environment, of course, in some instances, sharing water source with animals. You have all of these factors playing together. And also, probably I should even add, it has also been seen in places where immunization cover is quite low. All of these factors will come together. Yeah.
Now let's talk about the challenges or obstacles that exist in providing treatment and support to individuals affected by Noma, especially in regions facing extreme poverty and also limited healthcare resources.
Okay, thank you very much. Barriers, number one, where these patients stay is quite far. So you need to cross river, climb mountain, if you are really in search of normal cases. Another barrier, of course, financial issues. You need to make stops available. Just as was also mentioned, limited health care coverage. So these are some of the common things that you see. And maybe I should even add that by the time you are going to meet a patient, maybe you are in active search for cases. Take, for instance, somebody who had the defect, because for a survivor who passes through the acute phase and goes into the chronic phase, this person comes down with a defect and he lives with the defect for a long time. And there was a research done in the Middle Belt, not central, that was saying there was a particular person who lived with the defect for almost 6 decades. So if you see this person now, it will take you a long time before you can convince this person, because he has lived with it all his life. That's a chronic phase. But for somebody you see in the acute phase, finances, distance, culture, you can get to an environment where they feel, look, it's a witchcraft, or maybe it's a curse. So telling such person to come to the hospital for something that happened as a result of a curse or a witchcraft, it doesn't tally. So these are some of the hindrances we experience working with people. But then we still try to use some new concepts, persistence, to engage, and yes, we get results, but there are still more to be done.
All right, thank you so much for your time, Dr. Adetola Ifeolu Abiodun, Team Lead, Zero Noma Initiative. Once again, thank you.
You're welcome.